वक्रतुण्डमहाकाय सूर्यकोटिसमप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा। ॐ गणपते नमः। ॐ ऐं सरस्वत्यै स्वाहा. All right, so postpartum blues, postpartum depression, and this talk is about 40 minutes. I'll see if I can speed it up a little bit. If you have any questions, please type them in the chat. Okay, let's see, how do I get to the next page? Here we go. So postpartum depression is, the postpartum experience, rather, is dependent on the lifestyle, diet, and behaviors of the mother from antepartum, which is the period of time before conception, and then all the way to postpartum. So you have the prenatal care time frame, which is really important. And from a Western perspective, for those of you who don't know, I am a medical doctor, so I like to give perspectives from both the Western and Ayurvedic points of view. But from the Western perspective, this is the time where we counsel our patients. We ask about lifestyle, diet. We counsel on exercise, getting blood sugars under control, quitting smoking, and starting prenatal vitamins, etc. Folic acid is what we, immunizations up to date, all of that sort of stuff. Genetic counseling, and then the pregnancy itself. So that's when you have significant changes in physiology and the mental state. And that's 40 weeks. The postpartum period, which is around 6 weeks or so. So there is a positive correlation between postpartum blues and depression in the third trimester. So you have this, if you, in the third trimester, if you have depression, then you're likely going to have blues or postpartum depression when the baby is born. And postpartum blues is a shorter period of time and less intense. It's sadness, irritability, anxiety, worry, lack of focus, insomnia, poor memory, poor appetite. And postpartum depression is can last weeks to years. It's sadness, major depressive episodes, irritability, anxiety, worry, insomnia, poor memory, poor appetite, low energy, cognitive impairment, chronic depression. And these are the people sometimes you see in the news, some of the mothers who get almost crazy. Either they hurt themselves or hurt their child. Not everyone with postpartum depression will do that, but you see a lot of these news stories of women with severe postpartum depression that's unrecognized or not controlled, and then they go on to do major things. Conventional medicine hypothesizes that postpartum blues and postpartum depression both result from the hormonal changes, physiological changes in the body during pregnancy, neurochemical, neurophysiological changes, societal pressures, the pressure of, having a baby and managing children and going back to work, juggling career, and also just the mental state. So they correlate the physical change in the body and the state of the mind with depressive symptoms, such as helplessness, loss of interest, change in appetite, weight, poor sleep, fatigue, anger, and sadness. Give me 1 second. I'm going to try to increase this screen here. And then there's the estrogen withdrawal hypothesis. So postpartum blues and postpartum depression result from a rapid increase in blood estrogen concentration after delivery. So this graph shows you have blood concentrations of estrogen and progesterone. So progesterone's in red and estrogen's in blue. And right at the time of delivery, after the baby and the placenta is delivered, you have a sudden dip, a sudden dramatic loss or a shift in estrogen and progesterone blood concentrations. And you can see in the postpartum time frame that they're really low. So throughout pregnancy, estrogen increases in order to maintain the pregnancy, and also progesterone. 100 to 1,000-fold decrease in estrogen concentrations occurs 4 days postpartum. You have estrogen and progesterone drop and prolactin go up. And these concentrations of estrogen positively correlate to depressive symptoms. So that's a Western medicine hypothesis. Conventional medicine also says that prolactin and oxytocin are involved in this disease or this disorder. Women with postpartum depression have lower levels of prolactin. It is still there. It's higher than in a non-pregnant state or non-postpartum state, but still lower than average. And also low oxytocin in the third trimester, they say, positively correlates with depression late in pregnancy. Oxytocin is a hormone produced by the brain. It is responsible for uterine contractions. It's also responsible for milk ejection from the ducts. And it's also produced by both sexes, male and female, of all ages, and non-pregnant females as well, and men. It's known as the cuddle hormone or the hug hormone or the love hormone. It is a hormone that fosters love between two creatures. So they say that even a gentle touch to someone, a massage, a hug, warm words, physically, holding hands causes an increase in oxytocin, causes the brain to release oxytocin. So it's kind of a feel-good love hormone. And so when you have low levels of oxytocin in the third trimester, then you have this depression late in pregnancy and beyond. So postpartum neurochemical changes tell us that when serotonin in the brain decreases, you have worsening mood, and when serotonin, which is a neurotransmitter, increases, you have better mood. Also, levels of monoamine oxidase, MOA, in the brain were 43% greater in postpartum women compared to control groups. So again, when MOA, monoamine oxidase, goes up, serotonin goes down, and then mood also crashes. When MOA goes down, serotonin goes up, and mood is increased. There's also social factors. Returning to work 6 weeks postpartum is a lot of pressure. And recent studies have found that returning to work before 6 months increases the development of postpartum depression. It's almost as if you have the baby and in your mind you have a countdown. Oh, I have to go back to work in 6 weeks, and I have this helpless new thing, and I'm still getting to know it, and vice versa. And how can I go back to work in 6 weeks? And I remember when my first child was born, my daughter was born, and I was a resident. I was just a wreck having to go back to work. It was really difficult for me to leave her and go back to work. So that caused a lot of disturbance, and not necessarily in a postpartum sort of way chemically, but it was just sad. I mean, I would imagine that even a father on paternity leave would have felt the same sadness. So that's one factor, that around this time, 6 weeks, you have to go back to work, and it causes sadness. There is a pressure by society and magazines and media to return to pre-pregnancy weight. They show celebrities who are back to their pre-pregnancy clothing, who are back on the beach with bikinis, they ridiculous, like a week after they have their babies. And, these people, we have to remember, have personal trainers. They starve themselves. They have plastic surgeons. This is their job. Their job is to entertain. Their job is to look good. So that's their actual career. They get paid to do that, and it's unnatural. And they'll do anything to achieve those weights and those goals, and it's just not healthy. So we should not be pressured to return to pre-pregnancy weight. However, the media makes sure, even though we know that rationally, the media makes sure to remind us. Then there's family stressors with the new baby. It could be that your first child is jealous, or it could be that there is financial stress. It could be that you have to deal with your parents or your in-laws, etc. So there's familial stress, there's relationship stress. Maybe you're fatigued, you don't have time to give to your spouse or to your children. There's fatigue, just in general, globally. You don't have time to take care of yourself or work out or exercise. You are breastfeeding constantly, seemingly all the time, and you're just overwhelmed. So these are many, many factors, social factors. Let's talk about the Ayurvedic perspective. So Ayurveda recommends, like Western medicine, healthy, balancing, and nourishing activities in the preconception time frame, throughout pregnancy, and postpartum. So common sense things. This ensures good health for the mother and infant. However, Ayurveda goes further. So superficially, it may seem like it's kind of preaching the same thing as Western medicine, but Ayurveda will go deeper as far as recommending certain cleansing practices of the mind, etc., so that the baby is positively impacted. So there's Garbhini Vyakara. This is the management of pregnancy. So you keep a pregnant woman in good spirits. You practice cleanliness in the home. You clean yourself. You limit intense physical activity, and you eat nourishing sattvic foods. So the sattvic foods is something that Western medicine has completely glossed over. It has no clue. And then also the intense physical activity. The Western physician will say, in fact, often the board exam question will be, which of the following promotes low birth weight and miscarriages in a pregnant woman? And the answers will be smoking, drugs, obvious things. And then one of the choices will be vigorous exercise. And so all of them promote pregnancy loss, except for vigorous exercises, which is what the exam question is. However, so they don't hesitate to tell women that if you're already a fine trained athlete, you should keep running marathons. They really don't see that that's wrong. However, in Ayurvedic medicine, we do not recommend intense physical activity. Yes, you don't have bed rest. You don't lie around all day. You do you move around and you walk and you do gentle exercises, gentle yogasana, but you're not going to be jogging or producing jarring movements for the fetus, unlike Western medicine where that's okay. The pregnant woman is also kept away from the company of bad people or negative people. She's also protected from, or recommended to not see things that are unpleasant or hear unpleasant things, such as engage in gossip or engage in watching horror movies. A lot of times in India, the pregnant woman is shielded from eclipses. Monica G and I were just talking about the solar eclipse. Women are kept from viewing lunar and solar eclipses during this time. So in pregnancy, there is an increase in rasa dhatu. And the same thing in Western medicine, there's an increase in blood volume, is what we say. So remember, blood is a simpler way, is one way of looking at rasa. However, blood also includes rakta. So remember that blood is, rasa is not simply blood, it's rasa and rakta. So there's an increase in rasa dhatu, and that is so that the fetus can be nourished, the mother can be nourished, and we can also produce breast milk. So if you don't care for, if you have improper care of rasa dhatu, then you have poor quality and quantity. It also then negatively affects downstream, right? The quality and quantity of the other 6 dhatus. The woman will experience nausea, dizziness, weakness, anemia, and decreased nourishment for mother and fetus. We just talked about Pran Tejas Ojas. In the 8th month of pregnancy, the fetus begins to develop and mature its own ojas. It absorbs it from the mother. So, of course, ojas is this important, very precious, and very limited small substance, small in volume and quantity. So when the baby takes some away from the mother, it leaves her exhausted, depleted, and susceptible to depression. So that's a really interesting perspective, really interesting way of looking at postpartum depression, is that the mother's ojas is depleted or reduced. So in Ayurvedic medicine, the postpartum period is a time for rest and rejuvenation. The postpartum woman is pampered for the first 6 weeks after she has her baby. In the olden days, she would leave her husband and her in-laws, because usually in most of India, not all, it's a patriarchal society where the woman lives with her husband and the in-laws in the same house. So traditionally, in those kinds of households, in the patriarchal households, the woman would leave and go to her own mother's house so that she could be surrounded by her true family members who care for her. Not that the in-laws didn't or the husband didn't, but she would really be with her own mother. And who can take care of you better than your own mom, right? So she would go there and stay with her mother for a few months, and she would be pampered and massaged and given really wonderful foods to eat, and her mind would be at ease. So this is a time for the woman to heal, for her body to come back together, for the baby to really be nourished. Because if the mother is nourished, the baby is nourished. So vata aggravation of childbirth occurs, right? During childbirth, you have apana vayu moving in full force, expelling the fetus and the placenta. And this is very strenuous for the mother. There's the mental and physical strain of labor. It's painful. There's significant fluid loss. It could be blood loss, etc. And then also, the woman usually after having the baby will have a lot of diuresis, a lot of urination as well. There's dramatic fluctuations in blood hormone concentrations, like we talked about in the previous slide. And now this is another really interesting point from the Ayurvedic perspective, is that there develops this empty space in the womb after delivery. The presence of space is also in the womb and abdominal and pelvic cavity after cesarean section. And this empty space can cause all sorts of problems. There is gas and constipation due to the disturbance or even absence of Jataragni. And then there's the constant changing schedule of the newborn. It's seemingly the newborn is awake all night and asleep all day. So at night, I remember with both my kids, people would always say, "Oh, sleep when the baby sleeps," and that never happened. It just because you just weren't sleepy at that time, or you wanted to play with the baby, or it just was never. I could never sleep when the baby slept. And then, sometimes the baby would be asleep all day, and when it wakes up at night, you want to play with the baby, but it's time for you to really sleep. So you're all over the place with schedule. Now, I don't see the chat right now because I'm on a Mac, and when I make my presentation big like this, I no longer see the chat. So I'll come back and look at if you have any questions. Then there's postpartum blues and postpartum hetus, which are causative factors. So activities that deplete the physical and emotional well-being of the pregnant woman can cause these blues and the depression. So for example, being in an angry and negative environment, fighting and yelling, intense physical activities. So again, going right back to the gym, lifting weights, really, really long walks, running marathons. Again, all it goes against even common sense. Excessive sexual intercourse. There should be complete pelvic rest. Even MDs, Western physicians will tell patients that please do not have sex for the next 6 weeks after you have a baby. You know, your body has gone through a lot of trauma, and they will also, on your, as you leave the hospital, they will give you a prescription for Plan B, just in case you have sex. They want you to not have that conception go through. So they'll give you, here's a script for Plan B. In case you do have sex and you don't listen to our advice of not having sex, you shouldn't get pregnant in these next 6 weeks because it's too traumatic for the body. You should not fast. You should not overeat. Also, jagrana, going to bed late at night, napping during the day, can be depleting. Wearing tight clothes and clothing items that put pressure on the belly are also bad. We'll talk about abdominal wrapping. That's different. Traveling for long periods of time, traveling on bumpy roads, horseback riding, all of these, according to the stages, were bad for you. Suppressing natural urges. There was a separate lecture about that. So that's bad for anyone. Lifting heavy objects, especially since your whole pelvic cavity is all sort of discombobulated, it's bad to be lifting heavy things and causing hernias and whatnot. Seeing things that evoke feelings of sadness. Again, these subtle emotional energies are transmitted to the child as well. Eating meat is a no-no. Eating dry, stale, fermented things such as alcohol, heavy, hot foods are also bad. And again, depression in the third trimester of pregnancy is a hetu, or a causative factor, for postpartum blues and postpartum depression. So again, there's this pressure by society to be a super mom. There's this idolized image of a super mom. And this further aggravates Vata dosha, and not only in Western society, and also in Eastern, in India, there's a sort of this, the mother is sort of put on a pedestal. She's all sacrificing. She's, Mother India. She does everything for her children, and she sacrifices and things like that. And there's also pressure to be that ideal mom too. So that can be a little too much when a lot is expected out of you. So all of these expectations aggravate Vata dosha. So again, the mother is not resting. There's an incomplete period of rest. She's moving around a lot. So Vata dosha is active, and she's not grounded. So you can see how Vata dosha is aggravated. Improper diet that promotes further aggravation of Vata dosha and does not rekindle the Agni, which has taken a hit. Intense physical activity, again, returning to work too soon. Horseback riding, again, is vigorous and jostling, and that increases Vata dosha. Absence of abdominal wrapping. We talked about that space that is, according to Ayurveda, there's an empty space in the womb. So if the abdomen is not wrapped, and there are special ways to wrap, and I think, Monica ji, maybe you've demonstrated this during a retreat many, many years ago. I'm trying to remember this now, but I think you did show the students how it's done. But when that wrapping is not done, then Vata, again, is aggravated. Not nursing. Now, if you can't nurse, that's a different story. But if you can nurse and you don't, again, Vata dosha is aggravated. Again, this rush to return to pre-pregnancy weight, this self sort of deprecating negative view of your own body, and just juggling this new role can cause Vata dosha to be increased. And then this negative view of resting, oh, I don't want to just lie around sleeping. This fear of what people will perceive if they catch you taking a nap. You won't be that ideal super mom, so you shouldn't nap. You don't want to be seen as weak or tired. And then again, there's family stress, childcare stress, etc. So there's Purva Rupas, there are two schools of thought. One says there are no Purva Rupas. Childbirth itself, the space, the air that's, the empty space, hormonal fluctuations, inevitably anyway leads to development of these hetus or causative factors. And all women experience this in the process of childbirth. Therefore, there are no Purva Rupas. And then there's another school of thought that says there are Purva Rupas, which are stress, previous depression, low self-esteem, things that you go into the pregnancy with, prenatal anxiety, difficult infant temperament, colic, absence of family support, financial strain, etc., childcare. So experience of these Purva Rupas increases the susceptibility to postpartum blues or depression. Purva Rupas for postpartum depression include Vishada prior to pregnancy, which is depression or sadness. Vishada during pregnancy, especially in the third trimester, postpartum blues, and stressors such as we mentioned many times, low self-esteem, anxiety, etc. So how does postpartum depression manifest? For a Vata woman, again, we all know we're a combination of Vata, Pitta, Kapha. We could be one, we could be two, we could be all three predominantly. So this is simplified. But Vata predominant people will experience anxiety, fear, difficulty sleeping and concentrating. They are easily distracted, they're overwhelmed, they're stressed out, they're skipping meals. They may be producing scant breast milk, so that's also causing stress with childcare, etc. Pitta woman will be angry, irritable, irrational, self-critical. She'll have low self-esteem as well. She'll be maybe suicidal, which is violent toward herself and angry toward herself. Kapha will be in emotional denial, greedy, lazy, emotional attachment to food, attachment to possessions, etc. Overly sentimental, hoarding. Let's talk about the samprapti or development of postpartum depression. So in the preconception antepartum stage, you have one or more contributing factors to poor physical and mental health. So you have poor ahara, poor diet, okay? Unhealthy vihara, which is lifestyle. Negative vihara, negative actions. Negative or immature vichara, which are emotions or thoughts. And then again, a history of prior depression or prior vishada and a genetic predisposition to vishada. You may not have had depression, but it's in your genes. So these are, again, contributing factors to the development of depression postpartum. Pregnancy can again be compromised by poor diet, again, unhealthy, vigorous vihara, negative vihara, negative or immature vichara, which are thought processes, and vishada in the third trimester. And then again, during labor and delivery, so intrapartum, you have vata aggravation, you develop an airy womb, you develop reduced Jataragni activity, fatigue, depletion overall. And then in the postpartum period, you have activities that prevent the physical and mental rejuvenation of the new mother. So again, she's expected to jump into housework, raising other children, exercising. Sometimes she's cooking for other people. She doesn't get a break. She, has a taxing diet. Maybe she's eating junk food, microwave food, processed food. she's back to vacuuming and doing the dishes. And then she may be engaging in activities that not only do not balance Vata dosha, but further aggravate Vata dosha, such as, again, poor diet, being in a hyperdrive mode, traveling, flying, etc. So chikitsa, how can we treat or manage or prevent postpartum depression? We look again at the doshic constitution. As with any patient, we look at the doshas. We then also consider the daily routines, diets that are appropriate for the dosha. We look at the age of the mother. We take a look at the season, geographical location, health issues, lifestyle. Now, who does this in Western medicine? It's just we don't consider these things. How fabulous and how wonderful that we look at things like season and geography. It's just always blows me away. Because these factors may differ between individuals, the Ayurvedic approach to treating and or preventing postpartum depression is individualized on the basis of factors contributing to Vishada. Makes sense, right? So, specific measures that we can recommend for women during pregnancy, we have them consume a semi-liquid and sweet diet in the first trimester. According to Ayurvedic texts, the fetus is considered to be in a fluid state in the first trimester. Indeed, even in Western medicine, this is the time period where the fetus is most susceptible to outside influences, what we call teratogens, which are substances that cause mutations in the fetus. So the first trimester is very important. There are certain medications that can be taken in the third trimester, which cannot be taken in the first trimester, because again, the fetus is undergoing its most rapid, I would say, cellular changes. The cells are just exploding and dividing rapidly, and things like the genitals are being formed in the first trimester and major organs. So we try to keep the first trimester very, very free of harmful substances in Western medicine. And similarly, in Ayurveda, we take care. Sweet diet, semi-liquid diet. These are thought to percolate easily into the womb, into the fetus. So honey, milk, rice, ghee. Again, sattvic foods. These are all sattvic foods. Morning sickness is aggravation of pitta dosha. Now, some women don't experience morning sickness. I did with both my children. Not only was it not limited to the morning, it was all day, and it usually goes away by the first trimester. Mine was for the entire pregnancy for both children, so just miserable. It's extreme pitta dosha aggravation, so you should eat a little food in the morning, eat small and frequently, coconut water, almonds, walking, abhyanga, milk with rose water, hydration, herbal formulas, which is shatavari, kamadud, shankha bhasma, moti bhasma, and ghee. Abdominal snehan or oleation gently during the second trimester, not vigorously rubbing. This ensures optimal fetal development. And then recommendation to consume ojas promoting food during the 8th month of pregnancy. Why? Because the fetus absorbs ojas from the mother in the 8th month, which leaves her exhausted and tired and depleted. So the mother should therefore bolster herself, her own ojas, with ojas promoting foods. Again, ghee, honey, dates. The woman should consume foods that nourish rasadhatu. Again, rasadhatu increases. We talked about that in pregnancy. So in order to function, the mother and the child, and to produce breast milk. So if your rasadhatu is not nourished, then you don't have enough to go around. So again, coconut water is recommended. Fruit juices that are diluted, grapes, ghee, maple syrup, basmati rice, agave nectar are all good. The mother should have easily digested foods. Remember, the Agni is taxed, the metabolism is slower, so we should avoid heavy foods that require large amounts of energy to digest. The mother should eliminate those vigorous physical activities. She should stay active, but she should not be horseback riding or marathoning or whatever, running, lifting weights, or running for walking for prolonged distances. Mild exercises such as walking, gentle yoga, and swimming are all fine. And in fact, these can help reduce edema, which is the swelling that happens in the feet and ankles, the bloating. So these kind of help move the body around, move the lymphatics around, and help reduce that swelling. She should be calm, happy, live in a calm environment. She should be kept happy. She should keep herself happy and balanced mentally. She should reduce her own stress. She should rest, especially as you get towards advanced pregnancy. When the feet start to get puffy, she should raise them so they are at a higher elevation than her heart to decrease swelling. She should go to bed on time by 10 p.m. And in Ayurveda, after the 8th month, a swab is soaked in oil and placed in the yoni with the vaginal canal to ensure smooth passage during delivery. Whenever, I don't do it anymore, but when I used to deliver babies, in Western medicine, you don't do the yoni pichu, but I would massage the perineum as the mother is in labor, in the labor room, delivery room. The physician has a tray next to them, and the tray would have, my tray would have several plastic little containers of mineral oil. And so you literally pour the mineral oil on the perineum as the mother is, her legs are up in the stirrup, and you massage with your hand the perineum, which is the space between the vagina and the anus, because that is stretched. The baby's head is up against it. The perineum becomes very long and very stretched out. And you massage the perineum continuously with baby oil, mineral oil, so that the head doesn't tear the perineum on its way out. So in Ayurveda, however, the nice thing is that they do this in the 8th month before it's too late. They start early. Oh my goodness, I just screensaver. How did that happen? Sorry. Okay. Postpartum, the woman should eat fresh, warm, wet, cooked foods, unctuous foods. Again, foods that promote, that decrease vata, promote ojas. They build ojas. Sip on warm foods, and make sure that your food is cooked by friends and family. Remember, the vibration of the chef makes all the difference. Make sure the food is offered. We often offer it to our Ishta Devata, our deity, our chosen deity, whomever that may be. Offer the food to that one. If there is no one around to help the mother, then she should cook things with minimal time and effort. Does not mean to stick it in the microwave or instant frozen foods that you stick in the microwave, but easy foods that are easy to make. She should eat sweet, sour, and salty tastes. Again, these are helping to balance the vata dosha. So yams, pumpkins, honey, basmati rice, fresh fruits. She should eat easily digestible foods because the Agni activity is low after delivery, so avoid things that are taxing, such as fried, processed, frozen, sweet, canned, microwaved, etc. Lots of energy to digest, and they just don't have the pran to nourish the body. A light diet is ideal, so start with a light diet and gradually advance it as the Agni becomes stronger. Avoid gas-causing foods such as onions, cabbage, raw garlic, fermented foods, cheeses, sodas, because these can cause colic also in the baby through the breast milk. And sometimes the milk can smell funny, so the child does not want to nurse. If you have especially very pungent foods, the child will often turn their face away, doesn't want to have the breast milk because it just doesn't taste good. It tastes bad. Eating meals at regular times of the day, again, balances Agni. resting as much as possible is helpful. Going to bed on time, napping while the baby naps, in theory, yes. I don't know. For me, it never worked, but for some women, I'm sure it does, because you have to anticipate disrupted sleep at night, so you should sleep when the baby sleeps. Abhyanga is important. It counteracts dryness. It removes mala, which is waste products from the tissues and muscles, which are tired. It promotes lactation. Again, Abhyanga increases oxytocin. Touch, human contact, skin contact increases oxytocin. So when your baby is born in the hospitals these days, there's a rush to put the baby skin to skin contact. There's a rush to put the baby on the mother's chest immediately after birth. As soon as it's dried off and cleaned by the nurses, they will hand the baby to the mother so that she can cuddle with the baby, because this improves bonding between mother and child and promotes lactation. So Abhyanga, just that massage itself, promotes relaxation and oxytocin release and promotes lactation. And also the oils that you use are nourishing as well. Those are absorbed by the skin. And Abhyanga calms the mind. The house should be kept warm and not drafty. Showers should be warm. Dressing should be warm. In India, there's a big, the postpartum woman is not allowed to walk around barefooted usually because the floor is cold. So she's told to wear slippers or socks to keep warm. The abdomen is wrapped. So these are long pieces of cloth snugly wrapped around the abdomen to reduce those empty spaces in the pelvic area that we talked about earlier, and also restores organ and muscles to back to their original place. Breastfeeding is best, promotes calmness. We all know the benefits, contracts the uterus, and so the mother should consume foods that promote breast milk, such as milk, ghee, coconut, cereals. And she should take things such as fenugreek, which is methi, ashwagandha, shatavari. These all promote breast milk supply. Yoga should be done. Yoga should be done with in a calm and restful state of mind. It should focus on grounding postures. Again, gaze should be downward. Everything should be slow yoga, not hot yoga, not fast, but calming yoga. Meditation can be moving, it can be group, it can be guided, whatever. Find a way to meditate, find a way that works for you. So I think we're okay on time. Conclusion is to incorporate Ayurvedic practices during pregnancy and postpartum to help your client avoid post-birth complications and to help her diminish or decrease the occurrence of postpartum blues and depression. These are things we can all do for our clients. Women who adopted Ayurvedic practices during pregnancy and postpartum periods reported feeling more rested, healthier. They had more enthusiasm and joy and confidence. They were happier. They were physically and emotionally stable, had less fatigue. So Ayurvedic practices can have positive effects on the body and the mind of new mothers. And this is a great alternative approach to treating and preventing postpartum blues and depression. And here are the references. This is Dr. Celia Ibrahimi's talk. And let me get back to the main window so I can see what the chat is about. And that's it for me. If you have any questions, please type them in the chat. Have a great day, everyone.